Hello everyone, I'm drberkkkaratas. Our question is, why do we masturbate? What do we need to do this for? I'll briefly talk about this point by point. The first 5 points are our healthy reasons for doing it. In the last 2 points, I will talk about the unwanted reasons for doing it, which are currently being practiced but are not healthy. Now, masturbation is a healthy act. Masturbate first if alone at the right time. The recommended first sexual act is to masturbate if you don't have a partner, but it should be done at the right time and under appropriate conditions. This way, you get to know yourself. This is how you prepare for a relationship. This way, you get to know yourself. This is how you prepare for a relationship. Masturbation is also a way to prepare for a relationship. The better you prepare, the fewer problems you'll have during the relationship. You get to know yourself. You create fantasies. What you enjoy in your fantasy world. You understand what parts of your body are sensitive and what you enjoy. So, in conclusion, you get to know yourself. If you don't have a relationship, it serves as a substitute for a relationship to calm sexual urges, because when sexual urges come, they are not something that can be suppressed. It can be suppressed. It's not right to suppress it. I'll explain that in another video later. When your sexual urge comes, you need to manage it without suppressing it. As long as you manage it correctly, there wouldn't be any problem. One way to manage it correctly is to masturbate instead of being in a relationship if you don't have one. This is done for that purpose. Physiological relief is mostly for men, because there is a fluid buildup in men. So when we ejaculate, a fluid comes and it's called semen. This is continuously produced. So it's produced like the saliva in your mouth. You either need to spit it out or swallow it. You can't hold it in your mouth. The secretion in men is like that too. You know, if you don't ejaculate at certain intervals, it creates a feeling of fullness and discomfort physiologically, and it's the same for men. Of course, it's like that psychologically, but of course the psychological aspect is actually more applicable to women. It's the same for men. It brings psychological relief. To avoid ejaculation, your sexual drive is increasing and increasing, but you're not doing anything. It's increasing. Freud says this creates a psychosexual pressure. It needs to be compensated appropriately. Therefore, masturbation is done to relax both psychologically and psychosexually. Besides, we recommend using masturbation not just alone, but also between couples. Because every time kissing, playing, engaging in foreplay, and having the penis enter the vagina is actually a kind of kiss-lift-insert hypnosis for both men and women. Therefore, if there is even the slightest problem here, it can cause some issues for both parties. Also, the man is always the one who needs to penetrate, and this is always perceived as a goal, which can lead to some issues. Sometimes it's one-sided, sometimes it's mutual. Both are recommended to engage in mutual or unilateral masturbation. So, honestly, we say that sometimes the penis-vagina relationship should be kept in reserve. Yes, it's also done with certain emotions. So generally speaking, you should engage in sexual activity because it is a sexual drive. But you should relieve your anxiety, sleep. If you're feeling angry and you masturbate to calm your nerves or for any other emotion, that's a serious problem. In fact, I think that doing masturbation incorrectly is what we call traumatic masturbation. I referred to this as counter-traumatic masturbation in relationships. It's easy to fix that. So we can correct a man's masturbation by rubbing or by giving a woman a highly vibrating device for her clitoris. Its exact shape, we can fix it by doing it repeatedly in accordance with the exact relationship. It's getting easier, but masturbating due to these emotions can be quite difficult to correct. In this regard, it may require long sessions with good sex therapists or people who are well versed in this topic. If you masturbate for such a reason, please don't. In the future, sexual problems may arise. Besides that, it's something suitable for today's context. There are excessive stimuli. Back in the day, there weren't so many stimuli back then. In the past, I guess you could only see a woman's breast in person, maybe 50 or 60 years ago. But now, you can see it anytime and in any way you want, right at your fingertips, in the palm of your hand. Of course, doing this for a long time, especially watching visuals and masturbating at the same time, leads to serious problems. We've been talking about this for years. it's causing traumatic masturbation and the syndrome associated with it. So it's not right to ignore or suppress these excessive stimuli. I mean, that's not right. You know, there's something here. No, I won't suppress it at all. That's not it. The key is to be able to manage whatever the topic may be. I made a video on fantasy and visuals during masturbation. Discuss managing visuals and fantasy. You can watch this too. How will we manage visuals and fantasy there? How will we manage it without suppressing? I had explained that you can do it that way. So, in summary, people generally masturbate for these 7 reasons. Thank you.